So yeah, a little continuation of what I was doing before. I guess my cancer prognosis, diagnosis, whatever the hell. Really, when it comes to cancer, they don't tell you a lot of the things that you go through, so it's still kind of a question mark. But they cut the bladder cancer out of me, about 2.4 centimeters by 1.6 centimeter papillary tumor, which is actually the most common tumor, and it's one of the quote-unquote better tumors if you don't want to have invasive cancer. So when they cut it out, they see if it's got into the muscle tissue or not, and that I'm waiting on those biopsies to come back and whatever my future is going to be as far as bladder cancer goes. And when they found, I did a second CAT scan, and they found a 5 millimeter nodule that time on my left lung, and which is very small. Generally, statistically, they say that that's something they won't even look at because it always ends up being benign or whatever this, cancer information that they've gotten over the years. But my lymph nodes are slightly swollen, and my doctor says that that's not indicative of bladder cancer, so they may have to check out this lung nodule. Other than that, all my other organs seem to be okay. And they've been CAT scanned several times, and they're going to probably be CAT scanned and PET scanned again. And I've had quite a few x-rays. It's kind of hard to think that I actually have had so much go down over the last 2 or 3 months, but actually most of that's gone over the last month. My heart's okay, my pancreas, my liver, my gallbladder, so on and so forth, my stomach. I haven't found cancer anywhere else. Of course, I haven't looked at my brain, but I really don't think that's the case. So if the nodule is benign in my lung, then, bladder cancer is probably going to direct me towards, I have to have chemo shot into my bladder like 3 or 4 times a year. I could have to have return surgeries. These are like scrapings. I think they're called TRBTs. Well, my procedure was called like a bladder tumor resection is what they call it. And with any luck, it didn't grow into the muscle tissue, and I don't think it's grown through. The doctor, they only take you one step at a time with this stuff, and, they don't want to say too much, I think, but, he doesn't suspect that it's grown into the muscle, but they do have to check that out. So I really think that I caught it early enough, and I just got lucky. You can't just walk in and order up a CAT scan. They happened to do that because they thought I'd perforated something or bleeding internally or something like that, and that's when they found it. So keep in mind, when it comes to bladder cancer, a lot of people only find it the first time when they pee blood, which I had never done. And then after I got my CAT scan, I ended up being blood.